Have you been dealing with Achilles pain for months, maybe even years, and nothing seems to help? You've tried rest, ice, stretching, maybe even physical therapy, but the pain keeps coming back. Here's something that might shock you. You might be treating the wrong condition entirely. Today, I'm going to explain the crucial difference between Achilles tendinitis and Achilles tendinosis, and why understanding this difference is the key to finally getting better. I'll also share some cutting edge treatments that are revolutionizing how we treat chronic Achilles problems. Stay tuned because what you learn today could end your frustration with persistent Achilles pain. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Every day in my practice, I see people who are struggling with Achilles pain, often for much longer than necessary, because they've been treating tendinitis when they actually have tendinosis, or vice versa. But before we get started, I've written a comprehensive book all about this and other running injuries, and I'd like to send it to you completely free. You can get your copy at www.runninginjurybook.com. Also, please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need. Let me start by clearing up some confusion about terminology. You might have heard the terms tendinitis, tendinopathy, and tendinosis used interchangeably, but they're not the same thing. The medical community has been debating these terms for years, and honestly, it comes down to an argument between researchers. Some prefer tendinitis, others prefer tendinopathy, but what really matters isn't what we call it, it's understanding what's actually happening in your tendon and treating it accordingly. Here's the fundamental difference that changes everything about your treatment. Tendinitis, with the suffix itis, implies inflammation. This is typically what happens in the early stages of an Achilles injury, usually within the first few days or weeks. Your tendon becomes inflamed, swollen, and painful, but the actual structure of the tendon remains relatively intact. Tendinosis, on the other hand, is a completely different beast. This is a degenerative condition where the tendon structure itself has changed. Instead of a healthy, organized tendon that looks like parallel fibers and parallel cables, you end up with disorganized, weakened tissue that resembles cooked spaghetti. This typically develops when tendinitis goes untreated or when the tendon is repeatedly overloaded over months or years. Now, here's why this distinction is so crucial for your recovery. If you have acute tendinitis and you treat it with rest, ice, anti-inflammatory medication, you'll likely get better. If you have chronic tendinosis and you're still trying to treat it like an inflammatory condition, you're going to be frustrated because these treatments simply don't work for degenerative tissue. Let me explain what's happening in each condition. In tendinitis, your body's inflammatory response is trying to heal damaged tissue. The inflammation brings increased blood flow, nutrients, and healing factors to the area. While this causes pain and swelling, it's actually part of the healing process. That's why anti-inflammatory treatments can be helpful in the acute phase. But in tendinosis, there's actually very little inflammation present. Instead, you have a breakdown of the normal tendon structure. The collagen fibers become disorganized. There's an increase in abnormal blood vessels, and the tendon loses its normal strength and elasticity. That's why anti-inflammatory treatments don't work for chronic tendinosis. You're not dealing with inflammation anymore. So how do you know which one you have? The timeline is often your first clue. If your Achilles pain started recently within the last few weeks, and especially if it followed a specific incident like increasing your running mileage or starting a new sport, you're more likely dealing with tendinitis. If your pain has been going on for months or years, if it's been a gradual onset without a specific triggering event, or if you've tried multiple treatments without lasting success, you're probably dealing with tendinosis. There are some physical differences that you can look for. With tendinitis, the pain is usually more acute and sharp, and the area might be visibly swollen and warm to the touch. The pain often improves with rest and gets worse with activity. With tendinosis, the pain tends to be more of a dull ache. And here's something interesting. It often improves as you warm up during activity, only to return later or the next day. You might also notice a thickened area in your Achilles tendon, which is the degenerative tissue I mentioned earlier. The location of your pain can also provide clues. Tendinosis most commonly affects the mid portion of the Achilles tendon, about 2 to 6 centimeters above where it attaches to the heel bone. There's also insertional tendinosis, which occurs right where the tendon attaches to the heel bone, but has a slightly different characteristic. Now let's talk about treatment, because this is where understanding the difference becomes critical. For acute tendinitis, the traditional approach of rest, ice, compression, and elevation can be effective. Anti-inflammatory medications can help reduce pain and swelling. Gentle stretching and gradual return to activity often works well. But for tendinosis, we need a completely different approach. Since we're dealing with degenerative tissue rather than inflammation, we need to stimulate the tendon to remodel and strengthen itself. This is where eccentric exercises become crucial. Eccentric exercises involve lengthening the muscle while it's contracting. For the Achilles tendon, this typically means heel drop exercises where you raise up on your toes and then slowly lower down, focusing on the lowering phase. Research has shown that eccentric exercises can actually help reorganize the collagen fibers in degenerative tendons and improve their strength. The key with eccentric exercises is consistency and progression. You typically start with both feet and then progress to single leg exercises as you get stronger. The exercises should cause some discomfort, not sharp pain, but a manageable ache. This is actually stimulating the remodeling process. But here's where things get really exciting. Now we have advanced regenerative treatments that can dramatically improve outcomes for chronic Achilles tendinosis. Let me tell you about 2 game-changing therapies I use in my practice. The first is called shockwave therapy, also called extracorporeal pulse activation technology, or EPAT. Despite its intimidating name, this treatment uses acoustic pressure waves, not electric shocks, to stimulate healing. When these waves penetrate your tissue, they create controlled microtrauma that triggers your body's natural healing response. Here's what makes shockwave therapy so effective in tendinosis. It increases blood flow to the degenerative tissue, bringing oxygen and nutrients essential for healing. It also breaks up calcifications in scar tissue that might be impeding recovery. Most importantly, it triggers the release of growth factors and proteins, your body's natural healing agents. The treatment itself is surprisingly comfortable. You'll feel a tapping sensation, but nothing greater than a 4 or 5 on the scale of 10. Each session lasts about 10 to 15 minutes, and we typically do a series of 3 treatments 1 week apart. Many patients notice improvement after just the first treatment. The second revolutionary treatment is platelet-rich plasma therapy, or PRP. This uses your body's own healing factors to accelerate recovery. We draw a small amount of your blood, similar to a routine blood test, and use a centrifuge to concentrate the platelets. These platelets control growth factors, specialized proteins that signal your body to send healing cells to the injured area. What makes PRP so powerful is that we're delivering a concentrated dose of healing factors directly where they're needed most. It's like giving your tendon a supercharged healing boost using your own biology. And here's something really exciting. We can combine these treatments for even better results. I often perform PRP first, delivering the healing factors directly to the damaged tissue, and then within a few days we begin shockwave therapy to activate and stimulate these healing factors. This combination creates a powerful healing environment that can succeed where other treatments have failed. The success rates with these regenerative treatments are impressive. For shockwave therapy alone, studies show 82% of patients experience complete resolution of symptoms. When we combine shockwave with PRP, success rates can reach 85 to 95% or higher. Now, I want to be clear about expectations. These aren't quick fixes like cortisone injections. Results aren't immediate because we're stimulating your body's natural healing processes, which takes time. Most patients begin to notice improvement within 2 to 4 weeks, with continued improvement over the following months. The full benefit might not be apparent until 3 to 6 months after treatment, but the results tend to be much more lasting. One question I often get is about insurance coverage. Unfortunately, most insurance plans don't cover regenerative treatments like shockwave therapy and PRP. These are considered cash pay procedures. However, Many patients find the long-term benefits and the ability to avoid surgery makes these treatments a worthwhile investment. Here's something important to understand about treating tendinosis. It takes time. Regardless of which approach we use, while tendinitis might resolve in a few weeks, tendinosis typically requires months of consistent treatment. I tell my patients to expect at least 12 weeks of dedicated rehabilitation, and sometimes it can take 6 months or longer to see full improvement. One mistake I see patients make is giving up too early when they don't see immediate results. Remember, you're trying to reverse months or years of degenerative changes. Your tendon needs time to remodel and strengthen. Another common mistake is trying to rush back to full activity too quickly. Even when your pain starts to improve, your tendon is still in the process of healing and strengthening. Returning to high level activities too soon can set you back significantly. Let me also address prevention. Whether you've had tendinitis or tendinosis, you're at a higher risk for future problems if you don't address the underlying factors that contributed to your injury in the first place. This might include biomechanical issues like overpronation or muscle imbalances in your calves or hips. It could be training errors like increasing your activity too quickly or not allowing adequate recovery time. The good news is that with proper treatment, both tendinitis and tendinosis can be successfully managed. The key is getting the right diagnosis and following through with the appropriate treatment plan. If you're dealing with persistent Achilles pain, don't wait to get it properly evaluated. The longer tendinosis goes untreated, the more difficult it becomes to reverse the degenerative changes. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you've been suffering with Achilles pain that won't go away, come in for a visit and let's figure out exactly what's going on and get you the right treatment. That link is in the description. Be sure to order my book, All About Running Injuries. I'm happy to send it to you at no charge. Just visit www.runninginjurybook.com and request your copy. Thanks so much for watching, and have a great day.